for lifestyle medicine.
That's where my
friend.
mind goes when I think about this stuff. And I don't know if it's just like overwhelming or is it interesting for you to answer. Was the questions
All of
like,
the above.
how would you describe the questions that I'm asking you? Because they are kind of like big, crazy stuff. Right?
My experience with Kaiser Permanente is Kaiser is ginormous. So depending on who you're asking, they have a set of priorities. So what I was struggling with is what are my priorities? What are my program's priorities? What are my leadership's priorities? What are Northern California's priorities? There's just so many cooks in the kitchen that it really depends. It depends on who you're asking. And you're asking me, but I'm not representing Kaiser Permanente. I'm representing me and my experience.
I'm going to kick it off by just asking, like, what is the biggest problem with health education right now as it relates to just from your experiences in Kaiser with La Clinica, just what is that main problem that you've seen that you've been trying to address?
I would say the first thing that popped in my mind was letting people know that we're here. Letting people know that we're a resource in the sense that we have to let our physicians know, we have to let our partners in the community know, we have to let our members know that we're here for them and we're ready for them. And once they find out about us, they're like, why didn't I know that this was here? Like I used to do pediatrics, so it's like parenting classes. You have a child, how do you parent? And we're here, we provide potty training, we provide picky eating support, we provide sleep support as far as my child won't go to sleep, what do I do? So there's so many examples of how I never knew you even existed. So one of the biggest problems, I think, is just letting people know that we're here and we're ready to support them.
And letting them know that you're ready to support them, that's the hard part, right? How do you actually get to them? Is it the pre-engagement piece? Is it the actual engagement piece? Is it then sustaining it thereafter? Like, how would you break down that problem and where you find the most like acute issue?
I would say once they find out about us, they come back. That's not the problem. It's more so letting them know that we're here. So connecting them, whether it's we're in the community and then letting them know we're here, or if it's presenting at a huddle in adult family medicine and letting our providers know what we offer, and then doing it again and again and again. There might be high turnover of staff. There might be new software that we're piloting with our doctors. And so really it's just, we can't have gone once. You always have to have multiple points of contact strategically over and over and over. And even then, that can still be like, oh, well, I didn't know you did this also, which is like, one is lifestyle medicine. It's existed for quite some time, but now our area is adopting it. So now we're really pushing it. And so any way that we can offer it or promote it, then we do.
Okay. So I think about health education, like as I've met Arlene, who we both know, who's on your team, I've learned that health education to me feels a bit abstract and also kind of vague because people know hospitals as a place you go to like get care if you're like, you get a broken foot or something like that, or you're sick or something like this, right? But when it comes to actually the hospital doing outreach to the actual community, what are the best access points to get kind of a wedge into kind of at scale engagement with different communities, depending on I guess where the communities are?
The first thing that I thought of was making sure you're connecting when it is the right time and providing the right information. A great area that you can do that in is when you have people who are expecting a baby, because there is a due date, and that is an opportunity to provide very motivated people resources. Another time might be when someone might be recently diagnosed with diabetes, for example. They're highly motivated, want to make changes, may need support with a glucometer. How do I get support? And then finding us here. We have this support. So I feel like the magic can happen when you provide the right thing at the right time, but then we're always here. So we're always trying to promote, we can do this, we can offer this, and trying to provide it to the key people who then work as that bridge for us to let them know that we're here as well.
So would you say that health education starts with first the patients who receive services and then you use that channel of engaging them when they actually are engaging with services to then basically share the content that you have for them to then engage them from that process, or is it a process where you're trying to actually do preventative work where you're just trying to get to like a school or to a whole community that has never engaged with services or not a member? Like, how do you break down that cycle, like of patient getting education and then people who aren't even a patient yet and then giving them education?
What comes to mind is more of a spider web. We're trying to hit all of the access points, but one common channel is the patients finding out the information from their doctor. That also carries a lot of weight because their doctor is telling them to come see us. That is golden. And then also, if they had seen us at a certain time of their life for a certain type of care, they may then think of us when they need it for something else. Like if we do have a parent with a child, that child is now a young adult, that young adult, so really trying to figure out how to best support them and provide that. But really, I do see a spider web of multiple access points of we really have to be on our game all the time and really making sure that we are not like we did this event once, oh, we're good. No, we have to do it again. We have to do it in a different place. Even in our service area, we're in San Leandro, Hayward, Union City, and Fremont. So we also have to be equitable in how we offer things. If we offered it in Fremont, what are we doing for our San Leandro patients, and likewise?
So let's actually latch on that spider web concept, because I think that gives a good visual of the set of, not problems, but a framework to how to think about the problems. So how would you break down what that spider web looks like in a particular community? I know that your jurisdiction is, the greater San Alameda area, but let's just talk about like a city. Like, how would you break down that spider web of problems of health education for a particular city or a particular community?
Well, we are very culturally focused in who we're supporting and serving, and then also what might be coming up for that specific community. I have more experience in San Leandro since I've been based here for eight years. And so looking at our Spanish-speaking population and what type of support they're needing, we're seeing a lot of, for quality, big push to make sure that we are servicing and providing our classes in diabetes in English and in Spanish, not just having an interpreter available, but tailoring the classes to be culturally relevant and in alignment with what is important. So what does that look like? There's a healthy plate right next to you. And that healthy plate has salmon, brown rice, and vegetables. So then if we're servicing the Latinx community, that actually might have like nopales, a different kind of rice. Maybe it's brown rice with a flair of like tomato sauce, different things. And then the protein might be like, how do you say this in English? Beans that are Peruvian beans or pinto beans, and really making it accessible and of interest. And so that's one example of who is in our community, what are issues that are coming up for them, and how can we best service and match their needs, and not just create a cookie cutter of like, here's your salmon and your brown rice and your veggies, but thinking about what really speaks to them.
So what I'm hearing is breaking down the community based on the populations. Is that a fundamental priority zero type of way to kind of do health education? Is you break it down based on populations and audience groups? Is that a way that you would approach it?
I think so. Coming from my background at a federally qualified health center at La Clínica, you do want to make sure you're aware of who is in your community and what do they need. What are their age groups, which would then help determine, like, are they in childbearing years? Do they need more parenting support? Are they elderly? What are they needing? So I think that's like a public health approach of looking at it.
Okay. Because, one thing that sparks in my brain is like, health education is the process of educating people in health, right? And there's all these technical, new scientific studies being released day in, day out, and every year. There's all these different kinds of populations and communities with different language types, and there's also different priorities as well, right, in new science and so forth. So it seems like it's a process of always, like you mentioned, being on your toes and always trying to be on top of your stuff.
Yeah.
Tell us about that. Like, how do you actually stay on your game when you're actually doing health education? Like, why is that different from like what, even what a doctor or a nurse experiences or what a patient experiences? Like, how would you break down?
I actually see similarities between the different audiences. If it's a patient member, if it's a physician, if it's us in health education. But we are holding that responsibility of when people are ready to make behavior modifications, they come to us expecting that we're up to date on the newest and the latest. So we do have access to educational tuition reimbursement. So every year we have access to that encouragement and support to use your funds or you're going to lose them. And keep up to date what kind of trainings are out there, what's the newest and latest. So for example, in lifestyle medicine, this has been unique because it's almost like a thread amongst these 6 core areas of health education, whereas I have a counterpart who oversees behavioral health, but one of the pillars is around like stress management and your mental health. So I also have to be aware of that. Whereas we also have someone who used to oversee tobacco cessation, and we have a pillar that looks at avoiding risky substances. So with this topic of lifestyle medicine, you have to be up to date in all of these 6 pillars, these 6 areas. Nutrition's one of them. So like, eggs are good, eggs are bad, eggs are not available. Plant-based diet. Do you mean vegan? No, not exactly, because vegan is more processed. Whole food, plant-based eating. What's that? So it's just really having to be on top of it and aware and educating yourself. What are the arguments for? What are the arguments against? And if we step away, what's the thread that we're seeing over time?
So with all those things you just mentioned, that confuses me, right? Like there's so many pieces there.
Yes.
And so when you think about all these different kinds of communities and populations in a city or in a jurisdiction, there must be some like if you were to look at the problem, like what is the main problem of health education as it currently stands nationally? What is the fundamental issue of where the space can actually excel and exceed if it were to crack this code? Like what piece is the missing link to get health education to really accelerate towards the outcomes and goals? And we'll talk about that in a bit, but what would you boil that down to?
Wow, you're asking me such big questions today. Well,
that's what I'm curious about.
in my eyes, I keep coming back to access, making sure that our members have access to us, whether that is they already have insurance here, but they don't know about us. Or if it's they're a Medi-Cal patient trying to figure out where they're going to go to use their services, will they partner with Kaiser? Do they know that we at Kaiser have a whole, we support Medi-Cal as well. So trying to think about access and timing, I think is a big one for me and what I've experienced.
Okay, that I think that's it. I think the access piece makes so much sense because even when I was like looking at through the lifestyle medicine website and the Kaiser website, there was a lot of links that went to actual resources that people can actually take and actually schedule, right?
Yeah.
And sign in and actually claim. So I think that's really awesome. Okay, so moving on, like what is the actual outcome and goal of health education? Like what is the purpose? What's the function of it? Whether it be for a small scale community health organization like La Clinica that you're a part of, or like for Kaiser Permanente, a national conglomerate of health institutions. What is the purpose, the goal, the outcome of health education as a function?
I guess I'm split between saying prevention, making people healthier, helping themselves get healthier, and the other part is just health education is a big part of behavior modification and helping them feel empowered to make the changes that they can. Getting diagnosed with diabetes, for example, isn't a life sentence. A big part of what we do in lifestyle medicine is looking at how you can make change to reverse chronic conditions.
So yeah, what I'm hearing is prevention. You don't want people to get the actual thing that is going to put them in a scenario where they're going to not feel good about the rest of their life. But also involved with that as a horizontal structures like behavior modification. Like people need to change their behavior in order to change their actions so they can actually prevent, their conditions or reverse their condition or whatever it may be, right? And you're saying, so I guess, does health education what's the purpose of health education in the managing piece? Because you talked about the preventing piece, you talked about the reversing piece. Is managing just dispersed into those two?
I guess it's looking at looking at the root cause of what's coming up and trying to address that. And in root cause, you might think like, oh, if it's a nutrition thing, eat healthier. But in health education, we're looking at, do they live in a food desert? Do they have access? Do they have transportation? So it really is, it's almost like a domino effect of what are they having access to and how can they manage it if they don't even have access to the things that they need. So a lot of it is resource sharing and partnering with communities, collaborating with other, we've even partnered with churches, figured out how to work with summer, how do you call them, summer education, where you can have children come get free lunches, but they also get books. We threw in hula hoops, did exercises with them. Maybe they're in a neighborhood that it's not really safe for them to play outside, so then offered a class on site on how to make things more tailored to make it safer to get exercise if it's not safe enough to go outside. So really figuring out ways to see where they are, look at their environment, and then look at how we can help support them.
So health education as a function and as a department, like in a hospital, for example, or a health institution, I think in modern days, maybe it's more normal. Maybe back in the day, it didn't even exist as a function, perhaps. So I wonder, with the space that you're in, what do like doctors and nurses don't know that you do? Because most people see doctors and nurses and practitioners who are actually treating the patients as the hospital, but then there's all these functions beyond that. Health education included as one, right? So what does health education as a function expand the hospital's overall function in the community to be? Like you just mentioned partnerships with churches. That's not what doctors and nurses typically do, but maybe they do, and maybe that's kind of been passed to a role like yours. So I guess the question is, what has the function of health education in hospitals expanded the scope of what healthcare is for the community?
Well, the way I can think of answering that is health ed is such an extension of the clinical team. And so if the doctors are being asked to see their members' patients in 15 minutes and barely have enough time to get through everything, we're an extension of that clinical team, and they come to us, and then we're able to provide the hands-on, like I mentioned, the patient who's been diagnosed with diabetes, and now they have to learn how to use a glucometer, and sitting with someone and showing them, I show them, you do it, we do it together, looking at how we expand that. And so it's really, when time has been taken away from the providers, the doctors, it's almost, in health ed, we're trying to provide that human touch back into it, and also all the resources that they're not able to go through in those appointments.
Yeah, I think you're hitting something really interesting, because like back in the day, like doctors and nurses, don't they go to the person's home and then they take care of them one-on-one,
Right.
and then there's that human touch already baked into it, and they kind of take care of the whole capacity. It wasn't divided in different functions for what doctors do. You have a joint doctor, you got a skin doctor, you got a general doctor, right? So as healthcare has kind of broadened as a system for communities, you're saying health educators have become the extension of the clinical team. They're the ones that are expanding the capacity for the patients to be better and to behave perhaps differently in the future, but then also adding back that human touch as well. And why is all that so important in the function of healthcare, or like the purpose of healthcare? Why are those things so important?
Well, I don't know how else to say it, but other than treating people as an individual, I think that's a big part of it. Otherwise, healthcare can be so, is it for the profit? Is it for the person? Is it for, I'm like trying to think of what I can say. But trying to think also about with health education, that's why I've dedicated my career to it, is that I really believe in it. I feel like this is a big heart, the big heart of healthcare, I would say, is health education.
Because it starts there, right? It's like if you're just stagnant at a bed, like I have psoriasis. If I just kind of, just took it, and I didn't know what, methotrexate was and how messed up it made me, then how would I decide to continue with it or not continue with it, right? So it starts with education in order for people to change their behavior, then to then make an action or decision thereafter, right? Okay, so what is this new wave of being healthier? You know, like what's going on with like the Gen Zers, the millennials, like us, I guess, and younger generations? Like, what is this wave? Like, why is it happening?
Well, I want to make sure I'm understanding what you're saying. So what I'm noticing is that what was being offered before in healthcare, these generations, Gen Z, millennials, they're like, no, that's not good enough. I'm going to go somewhere else and I'm going to find what I'm looking for. So that's what I'm thinking of when I hear you say that. Is that what you mean?
Well, when I think about this new wave of healthy living, I think about the conversations around keto and fasting and kids not drinking as much, which they shouldn't be anyways. But you know, just all these scenarios where it's just trending down with the behaviors of the past that people have found to be destructive to their individual health. But you correct me if I'm wrong. Like, what are you all finding? Like, what is the wave that you're all betting on? Like, what is an organization like Kaiser Permanente betting on with this new trend or wave with Gen Z, millennials, and these younger generations?
In the work that I've done, I've actually heard the opposite. I've heard that they're getting sicker younger. And so that, I think, is part of what my area in lifestyle medicine is trying to look at, is looking at the root cause and not just treating the symptoms.
So let's actually highlight that word root cause, because I think that word's coming up more for some reason. Is that what's trending? Is that people are starting to understand more of what the science is and like what the implications are, and they're more informed? So they're asking more fundamental questions about their health, like what is the root cause of psoriasis, or why I'm getting diabetes, or why I'm getting high cholesterol, or whatever it may be. Is that what's going on? Is that the trend?
I think if I make the trend be through my lens of lifestyle medicine, it's looking at the whole person and not just why is this person not losing weight, for example? Is it that they are not eating healthy enough or they're not exercising enough? With lifestyle medicine, we're going to look back at also like, how are they sleeping? Are they isolated? Do they have social connections to people? And looking at how that's all interconnected, and that might be the reason or part of the reason why they're not able to do those other behaviors, for example.
But what is the wave? Like, are you feeling a wave? Is there statistics or trends of where our health consciousness is going as a community or as a nation? Like, is there something going on that's like trending hard, you know, towards some direction that you're all finding?
I can only speak from the work that I'm doing, and one area that has been a hot topic has been like the weight loss medications, for example. And so even though we offer healthy weight classes, we offer medical weight management since the 2000s, where it's meal replacement medical therapy, or there is the lifestyle medicine where we talked about the 6 pillars. Most of that focus has gone to the weight loss medications, so that all of the programs that we've had from, and I can't really speak from each of them, but from 2 of them that I manage, medical weight and the lifestyle medicine, the interest has been more toward like weight loss medication. So having results faster and knowing that those options are there, but I want the results faster.
I guess let me try to reverse engineer the question. Okay. So why is Kaiser Permanente investing in lifestyle medicine? Like, why?
There's good results. And showing that we've tried these other things before in a silo, because it really has been engineered that way, where it is, we're only going to focus on this one aspect and we're not going to see the whole person. And in lifestyle medicine, there is a push to look and take a pause and examine these 6 pillars of 6 areas and trying to figure out where are you at with them, and then where is an area that you can have more like success, like quicker success, so that you'll keep going. And that's more with behavior modification, but yeah.
So And why? What was it before? Like, why didn't we see people as a whole person? You know, when
That's
it comes.
a great question. I'm not sure, but that's also how I've experienced it or how I've been trained in other topics. I've been trained in health education, and more recently, I've been training as a mental health therapist. And it's still handled that way. You have one class on this topic, you have one lecture on this topic, but you rarely look at how they intersect and how to weave them together, really.
And do we have like, does the industry have like new science, you know, on like how they do intersect and why that's important, and people are just more aware of that stuff and they're now wanting, you know, more FDA approved towards organic and, you know, keto friendly, you know, all these like foods that are coming out. Like what is that, you know?
No, I don't know. But the only place I've seen it more holistically connected has been with lifestyle medicine, and it is newer to our area. But
Okay.
before that, I hadn't really seen it connected in that way.
Interesting. Okay. So okay, break down what lifestyle medicine is. As it's defined by Kaiser or by other organizations, and people may understand it differently too, because maybe that's like a particularly like Kaiser branded terminology. Is there another way of saying it? Is it like functional medicine as well, or seeing people as a whole person? Like, what are the other terminologies in addition to that? Like, break that down for us.
Yeah, well, there's a definition I can give you, but then the one that I love the most is you imagine that you come home and the sink is overflowing. You come toward the sink, and what are you going to do first? Are you going to start mopping up the floor, or are you going to turn off the sink? Most Western medicine is looking at mopping the floor, dealing with the symptoms, not going and turning off the sink. And so I was about to say that's the root cause. So really thinking about how we're addressing what's going on and not just almost like placating the symptoms. Like, oh, okay, that's what you're complaining about. Great, take this medicine, make that symptom go away. But like, why is that coming up for you? What's coming? So I can go back to look at the definition for the lifestyle medicine. There are 6 pillars for better health that may not be in a pill bottle. So lifestyle medicine is an approach to care that integrates the 6 pillars. And what are those 6 pillars? It is the nutrition, physical activity, stress management, restorative sleep, social connections, and avoiding risky substances. And I have to look at my notes because it's almost like the 7 dwarfs and I always forget one. But those are the 6 key areas.
Yeah, so what I'm hearing is it's almost like a fundamental shift from a reactive system of healthcare to a preventative system of healthcare.
I would say so, yeah. I mean, it is embedded in looking at doing a whole check-in before, instead of just asking, you know, what are your symptoms? It's more so looking at these 6 key areas and checking in on how you're doing, and not looking for excellence, but looking for where are you struggling, where are you doing well, how can we continue to build on what you're doing well, how can we support in the areas that you're really struggling in.
And why haven't we done that before we started creating and inventing medicine? You know, I mean, I mean, is it because our system was like, yeah, we have a big disease right now. We need to have like a nuclear answer to how to solve this epidemic, right? And that's why the reactive system of healthcare has been the most like important system to build first. And now that we have that kind of like safety net set up, now we can focus on, okay, now that we have capacity, we know how science works, let's go to the stuff that's more like preventative. Let's go back to the basics and fundamentals of preventing all this, like working out, you know, and looking at our sugar levels and what we consume there, and sleep, you know, all this stuff. How would you break down, like how would you interpret what's going on, you know, with why we're focusing on it now?
Yeah, I wish I could tell you why we're focusing on it now, but when you were posing this question, I was thinking of, well, like, who was defining what healthcare or medicine was? Who was having access to it? Who were people in positions of power to fund or benefit or look at. Like, right, a minute ago you put this mic on me and gave me to put it in my pocket, and I go, well, women's pants don't have deep pockets. Why is that? So I could take you somewhere else, but essentially I really don't know why it started the way it was, but I think it speaks to who was deciding where we were focusing on.
So you mentioned the 6 items: food, physical health, stress, sleep, social interaction, substance. Is that in priority? How do you, if you were to see it as like a framework of these 6 things, how would you kind of create a spider web of that? You know, like how do you see all 6 things individually, together? How a patient or community member or anyone who benefits from health, which is everyone, how they should see these 6 things? Like how would you slice and dice that?
Yeah, well, one of the first questions I heard you say is like, did I list them in a priority order or a specific order? No, that's how they were listed here on the website. But this is a question that we have heard in our orientation class, and I've heard when I observed other areas as we were building our program. We have had members ask the doctor who's co-teaching the class with a health educator, where do I start? Which is the most important? And the first answer we say is there isn't a specific best place to start. Every person's different. We did have a member I'm thinking of who said, yeah, but like, where do I start? And every doctor, based on their training, may have a different answer. And so what we go to is go to where you're having some success and build there. And then also keep in mind, where are you struggling the most? And keep that in mind. If I were to give you a personal answer for me, I would say I'm struggling with sleep. I have 2 small ones. So right now, maybe the season of life that I'm in, I can't really make many changes. So I'm not going to focus on that. And I might focus on a different area.
And is there like a rule of thumb that you would give to just people who can benefit from this framework to how you approach it? Would it be like, and maybe you got some health educator tips in there, like some tricks, you know, like do you try to give all 6 concepts all at once so they all know what it is and exposed to it, and then you have them make it into like a habit? And then like, how do you make it into a habit, you know, and how do you have different populations take it in as a habit? Do you have to speak their language? Do you have to give them visual? You know, everyone learns different ways. Like how do you get people to consume these concepts and actually for it to be effective? Maybe you're not all the way there yet, and we'd love to know what you're still working on to make it more effective as well.
Well, right now, when I mentioned that we have this orientation class, we do highlight all 6 because we don't know who's coming to us and what encouraged them to come. What are they dealing with? But when we highlight all 6, we have some people that are very interested and they're like, I've never thought about it this way and I want more. And so what we're building toward in Northern California, our regional health education, lifestyle medicine, is moving toward building an intensive 12-week lifestyle medicine course. And within that course, a big focus is the nutrition on whole food, plant-based eating. And so that is a big a big foundation of what lifestyle medicine, that's something that's different that I haven't really seen too much of in other areas.
Okay. Is there an example you can give around one of these areas, like food or physical health or stress or sleep or social or substance abuse? Do they all have their unique concepts within each one? Is there like a main focal point for one you can give as an example, or 2 or 3?
Sure,
like
yeah.
For food, you mentioned the whole foods,
food.
plant-based kind of diet concept.
Yes.
So that seems to be a main focal
That's
area
like
there.
the main one, yeah. With physical activity, we know that having physical activity in your life, a goal of 30 minutes a day, that's golden. If you can do that, that's wonderful. And people usually think of how that will help reduce heart disease, stroke, diabetes, some cancers. But people may not know that having that physical activity can also boost your mood and reduce mild to moderate depression, anxiety, and stress. Physical activity can also protect memory. Physical activity can also improve your attention, thinking skills, and sleep. So if physical activity helps your sleep, then what does sleep do? So if I jump to my sleep notes, sleep can then help reset and restore how hungry, how your body and your brain signals how full you feel. And so if you are having enough sleep and you can actually feel full because you got rest, then that will impact your eating. So they're all interconnected, yes, and there are some key pieces to it, like the nutrition, the whole food, plant-based eating, for example.
So within itself, there's main nodes like food, whole foods, plant-based as a concept, right? For physical, exercise, 30 minutes. And these are kind of like nodes, but then there's a bit of a spider web for that, right? Like they all interrelated,
Yes.
right? And they kind of compound and make all the pieces better, right? Cool. So briefly, what would you say, this might be new on the inside of health organizations like admin, nurse, doctors, practitioners. How would you, as a health educator, how would you frame this for someone inside? Like, is this something completely new that there's a bit of friction on, like some doctors don't believe it or something like that, or is everyone pretty much on board and it makes total sense? Like, what is a piece of insight that you share internally all the time within the institution that you represent as it relates to this initiative, this campaign, these goals around lifestyle medicine promotion and adoption and so forth?
If I'm speaking to someone within the organization, I can look to some of our leaders, for example, in Santa Clara, who have a robust lifestyle medicine department, and they're able to track people who've just had one exposure to like a lifestyle medicine orientation class once, and this one intervention has affected their weight, affected their lab levels. That it's just seeing how you sometimes think like you have to do a lot, there has to be a lot of classes, or they have to have one-on-ones with our educators, but sometimes just one intervention can make a big impact. And then also seeing how I mentioned a moment ago, the wave toward like medicines, shots for weight loss, seeing how lifestyle medicine, the goal isn't necessarily weight loss, it's looking at the whole person, but seeing sometimes similar or better numbers when you're doing lifestyle medicine, and I mean numbers as weight, blood pressure, all of this, when you're seeing how there's no side effects with lifestyle medicine. Mm-hmm. So that's the piece that is phenomenal.
Okay, yeah, and so what I'm hearing is that there's just fundamental, wholesome, like ways to just accept it into their practice and how they recommend it, and it's just a great default, right? When a patient comes, sees a nurse, sees a doctor, they can now rely on these kind of fundamentals, and they know that the admin, the staff, the institutions kind of backing that. They're not just trying to prescribe people this, and this, that kind of thing, right? Is that what's going on internally?
I mean, that's something that I would share because lifestyle medicine is new in our area. So I would share that I'm looking at best practices around in our area, in our Northern California region, and that is something that I've noticed. The other thing I wanted to say is I would still kind of share what I would share with a patient, because our employees are our patients, members of Kaiser Permanente. And then also we know what we're supposed to do, but that doesn't mean that we are doing it either. So we just had a National Doctors Day celebrated in the month of March. It spilled over a little bit to April because we went to the 4 locations. And I was promoting lifestyle medicine, and I had a big trivia wheel where you'd like spin the wheel and I'd ask questions. And I was surprised, and I know it, I just said, even though we're supposed to do it, doesn't mean we do it, where the doctors would land on a trivia question like, are you getting 7 to 9 hours of sleep? And they're like, I know I'm supposed to, but I don't. Or whole food plant-based eating. I know I should, but I barely have time to eat between, So just also knowing that just because we work in healthcare doesn't mean we're the prime example of health.
I have a doctor cousin that eats like he's a just complete pig. So I like totally understand. But most seem to participate in like the stuff that they preach, right?
Right.
So how would you hope, like as a health educator with lifestyle medicine specifically as an initiative, how do you hope for the lifestyle medicine education concepts to land with people who are receiving healthcare? How do you hope for them to process it, take it, use it, and make it happen?
I would hope that it would land, that it would be encouraging, it would be a new way of looking at it, instilling hope, knowing that no matter where they are in their trajectory of life, in their health, that there is positive changes that can happen. And oftentimes it's just little things, like maybe one of the things I'm working on is not scrolling on my phone right before bedtime. So setting an alarm, so I turn off my phone, put it aside, do something else, and then go to bed, because all that blue light affects your sleep. So thinking about what small little changes can you make for large benefits, success. Yeah.
So you would lead with words like encouragement or hope, or these words of like, hey, these 6 things are things you can do for free in many cases, right? And it's going to help you with these specific areas, but then also it compounds and makes something whole happen as well. And you would just hope that it would land as like, oh, I feel encouraged now, or hopeful that I can actually try to fix this, not myself, but like fix it in some fundamental way. Is that how you hope for it to land?
Yes.
Okay. And then is that how it lands? How does lifestyle medicine land right now with you promoting to the communities? Like how is it going? You know, because it's a newer concept or campaign, right? Which is really kind of surprising when you think about it, right?
Yes.
Like it's just happening. It's like, okay. So how is it landing with people? How is it going? And what needs to be worked on still?
Where we're at in our trajectory is building the program. We have shared it with a lot of physicians. How I mentioned, we did doctors' days, and I've been seeing very positive, hopeful reactions from our doctors because I just work with them. Now tonight, actually in a couple hours, we're going to do our second orientation class that we have ever done here. The first one, it's hard, we're on Zoom, so you can't really, if they have their camera on, you can't see how it's landing. But from the evaluations, the surveys, people are really hopeful and interested in learning more. They're like, this is great, I want more. I also had people who said, yeah, I know, but like my situation is special. I want to do a follow-up with a doctor to ask more questions. But the program is still new, so we're still building, and I don't have more out in the community. We haven't, as far as I've been involved, we haven't done much in the community with it yet.
So this is actually really exciting because it's really, you can categorize it as an innovation in the community, right? Like this campaign of lifestyle medicine is actually new for many healthcare organizations, including Kaiser and other probably even community health, organizations and so forth, right?
I would say so.
So, and you're saying the way that you're sharing it right now is through orientations and programs online, where there's doctors and stakeholders at the health org involved, and then there's actual patients and members on the other side receiving the education, right?
Yes.
And you're in the process right now of going through a program and seeing how they do adopt and how it does land and how they do process it and how they do implement it. Is that, am I getting that correct?
That's correct.
Okay. And how would you interpret the future of how it does land? How is it, let's just start with the first part of it, right? Like, what are they saying? How is it landing? And where are you finding like what practically works or what practically doesn't work? Like, what are just some practical things you're noticing, right, with the programs you've been delivering?
Yeah. So for the folks who took our first class, it was a month ago. We're offering it monthly. And so today when I met with our medical director of lifestyle medicine, she was prompting me to go back and check with our members from a month ago to see how they're doing. And so I haven't done that yet. We just had that meeting. But trying to, other than the surveys and following up with them, it's still too new. So we're in that process now.
Okay, gotcha. And what are the priorities right now for your organization around lifestyle medicine? What is the priorities that you're working on right now?
So I can speak for our area, and right now it has been to establish the lifestyle medicine as an offering, like you would have the diabetes classes, we have pediatric classes, prenatal classes, all of this. And so establishing it as an offering, and you'd be surprised with how many little things you have to create and organize systemically in our organization to make that a possibility. And then once you've established it, the whole communication strategy and letting people know about it. And so right now it's still, we're in, I'd say Q1 of 2025 is when we really kicked it off, and it's April right now, Q2. still really new. Yeah.
So I'm hearing, number one, establish the offering, and then number two, it's really communicating that offering
Yes.
out, right? So how do you imagine, say, an army of young people and what their function is in a community in health education can do within those priorities of establishing the offering, communicating that offering, and maybe even the priority after that? How do you imagine an army of young people creating messages or communication strategies around it?
Yeah, well, a big part of it has been how do we provide this and who's our audience? And so right now, lifestyle medicine has been more 18 plus, but there's a big need for our under 18 as well. And so when I left pediatrics and I went to lifestyle medicine, my pediatricians were saying like, will you have a rendition of this for our pediatric patients as well? And I was like, not yet. We want to. Other sites have it, but for us, not yet. And so a big part of it is involving pediatric, 0 to 17, people who are interested in this to help us spread the word. And so just before that, I had checked with my my medical director of lifestyle medicine. She was asking me, does Kaiser Permanente have an Instagram? And I said, you know what? I don't know. Let me check. We do. And then she said, do you have a TikTok? I said, well, let me check. And I was like, they're blue verified, but they're followed by 188 people. So I was like, it exists, but it's underutilized. And so our big vision is to really get the word out, spread the message, and then as you're spreading the message, you too can focus on what works best for you and then highlight from there. Work on the strength that you already have. It's a reoccurring theme I'm hearing in lifestyle medicine.
Okay. Let me cap it with these two questions.
Okay.
What is your model profile of a health educator in a local community?
What do you mean?
How would you define, if you were to paint a picture of what a health educator should ideally be, what it is now, perhaps what it is in the future, how would you model what a health educator is today? Like, how would you describe that in, like, I don't know, 1 or 2 sentences kind of
All
thing?
the tough questions today. I guess it really is someone who is encouraging and supportive and knowledgeable, who's really side by side with a community member in their health journey.
Love it. And I know that I would love to allocate way more time to this, but how would you summarize your story of becoming one?
I would say I always wanted to be a teacher, and I didn't know what type of topic I wanted to do. I just knew I wanted to help people. And when I stumbled into health education, I knew I'd found the right place. Yeah.
Love it. Cool. Thank you, Magdalia.
Thank you.
Appreciate it.
Great.
That was awesome.
Awesome. Thank you.
I know I asked a lot of hard
I
questions.
know. I'm
too.
like, I can prepare for lifestyle medicine.
That's where my
friend.
mind goes when I think about all this stuff. And I don't know if it's just like overwhelming or is it interesting for you to answer. Was the questions
All of
like
the above.
how would you describe the questions that I'm asking you? Because they are kind of like big, crazy stuff. Right?
My experience with Kaiser Permanente is Kaiser is ginormous. So depending on who you're asking, they have a set of priorities. So what I was struggling with is what are my priorities? What are my program's priorities? What are my leadership's priorities? What are Northern California's priorities? There's just so many cooks in the kitchen that it really depends. It depends on who you're asking. And you're asking me, but I'm not representing Kaiser Permanente. I'm representing me and my experience.
Yeah, because the goal of a health organization is also to have members that they're serving too,
Yeah.
right? So health education has a part focus too of just like getting concepts out there so that you're becoming relevant as well. In addition to helping people side by side and actually supporting them as well,
Yeah.
right? Anyways, I know you got to go at 4 and it's
Yeah.
like 1 minute till 4.
We're
so-
good. We're good.
You're good?
Yeah, I always
Okay.
add a buffer just in case.
Okay, great, because I was going to ask you way more questions.
Oh, really? No, time's up. What were you
Okay.
going to ask?
Not tons more questions. I was going to elaborate
Okay.
more on some of the questions. Like one question I would ask is like, as like a bonus would be, like if you were to experience health education, lifestyle medicine content, and maybe for the Gen Z, the millennial population, how would you want to experience that content? What type of content would you want to learn about, when it comes to fitness offerings with ClassPass or wellness coaching or mind-body medicine or symptoms of stress or using apps like Calm or, you know, participating in programs, social connections. Like there's a lot of awesome content you have in the website that can be made individually into pieces of content that are regular, normal, or wild and crazy and kind of meme-like and kind of viral. So I wonder how you might suggest, you know, an army of young people who can create content, how they would create content.
I would want them to make it as experiential as possible. And what do I mean by that is, for example, I've been involved with a lot of nutrition classes, and it's very lecture style. But what's newer with lifestyle medicine is this whole area introducing culinary medicine. And so we're seeing doctors who are putting on the apron, they're prepping, they have a camera phone toward the food, there's a camera toward them, and then they are providing the recipes to the members ahead of time so you can be cooking virtually side by side. That to me is, I haven't seen that before. We used to have cooking classes for pediatric patients when we had a grant here, and that was amazing. It was the electricity in the air when you would have the parent-child family unit creating like a kale salad, and the kids are putting lemon and massaging the kale. They will then take that and make it again, versus me sitting lecturing, telling you about the healthy properties of kale. It's really that experiential piece, I think.
Yeah. How would you want to take all the content of words that you have on the website into experiential items? Did you ever have like an idea of how you would do that? I mean, you just gave one really great example.
Because that's how I've seen it done. So then I was like, because we replicated it something like that for our staff in adult family medicine on Valentine's Day. We did and there was a segment, it was like a 2-hour segment, and part of it was the lecture. And you could feel it like, okay, that's what we do in healthcare. And then we had them do taste testing. You've never tried almond milk? Here, taste it. Have you ever had, what did they do? It was quinoa, not quinoa, the other little chia seeds, and putting it in yogurt and seeing how it changes, and this is a dessert, and everyone's like, they woke up. And then they took the recipes with them. They had we went back to the department, they were sharing, you know, I'm like, why don't we do this? This is what I want to see more of.
So if you were to, sorry, I know we got to go now.
Yeah.
I would say I would encourage the kids, like, take what you're saying and make something, get really specific with a piece of content and just kind of like see it how you would want to see it, right? And in many ways, the more shocking or interesting it is, almost the better, just so it can actually land and be processed by the person consuming the content. Would you agree with that?
I would. Because even thinking about like stress management, having them do, like if you're doing like a TikTok, having the audience do it with you in that moment. And so I think that it's like, oh yeah, I'll do it later. Like I save all my videos and I never go back, right? But having someone do it in the moment, I think that's priceless.
Great, thanks, Magdalia.